It's not. I think it is. It might just be delayed. All right. Hey everybody, it's Zach with Palantir Research here. We got a great episode or live stream for tonight. I know it's out of the ordinary for me to do this at 10 p.m. Central Time, so I know a lot of you may not join, but I think it's really important that I discuss today at least what is happening and what Palantir released today for TGH. So I do have a small agenda here, but essentially it's going to go over the video that came out today. It's 19 minutes long from Tampa General Hospitals, or TGH, and they do provide a lot of nuggets here that are important. So if you haven't checked it out, I do recommend you being able to look through it there. And it is 19 minutes long, so you can speed it up, obviously. But I am going to focus on a few parts of the video, and that actually ties back to the agenda here. So I'm going to go over my background really quick, just so you know why these jumped out to me and kind of my background on the knowledge of this. And then also healthcare industry consolidation there. And there are nuggets about that too when they talk about their expansion within Tampa Bay, and then also HAS, or hospital acquired sepsis, and then accurate coding there. And this was actually on their results page. So it's going to be kind of an action-packed episode here. I did it in this format as a live stream because there is kind of a lot of things to talk about and back and forth questions that'll probably come from the audience here. So I'm glad for you guys all to join. I know there's a bunch of viewers starting to get on the stream here, so thank you very much. But I'm just going to dive right into it. And for those who just joined, I will be talking about Tampa General Hospital here, but I'm going to just focus on the things that kind of stand out. And the thumbnail does say not staffing, so I'm probably not going to talk about that, but it is a very important part as well of the healthcare industry and hospitals specifically. It is a huge cost to them. So let's start out here. Let me just show the agenda one more time. So my background, very quick. So I've been working in healthcare basically my whole professional career. I've been at different aspects of it though, so I haven't been sitting in one spot. So I would say my first real start in healthcare was on the insurance side, the payer side. So just think of those who, you know, if you get if you're an employee somewhere, you're gonna have a healthcare plan, because if you're not insured, essentially you're just gonna get billed the full amount there, and there's not gonna be a pre-contractual agreement between that provider and your insurance, right? If you don't have any insurance, you're just gonna get what they pay for, or ask you what they pay for you. And those are negotiable here, but you hear about in America the difficulties of paying off medical bills and the exorbitant costs that come with it, especially for something very expensive like an inpatient visit or a surgery. Now, not just the payer side, actually. So I was actually working in audit there on the network side. So this is that contractual part I was talking about. There's certain hospitals and certain providers that if you go to them as a patient, you're going to have a better rate. You don't have to pay as much. And there's certain reasons for that. And it can vary for lots of reasons for insurers. And it's not necessarily always money motivated there. It can be just for coverage, because they do have to meet a legal requirement per se, but it can really vary. And then I've also worked in the ERP side. So Enterprise Resource Planning Tool, it was a SaaS provider that I worked for, and I was on the data integration side there. So I was working directly with health systems as our clients and making sure that we get the right kinds of data, so financial data as well as EHR data, claims data, all that stuff, tied into our system and make sure it comes into a format that we like, and being able to do tests there, right? What's the accuracy of these, and is this expected behavior for that data? And then moving on, I've also done auditing, and I think this is probably the biggest aspect, I think, for my background that helps with these things that stand out. And it really does touch on these three aspects here with healthcare industry consolidation, hospital-acquired sepsis, and accurate coding. So all of those are going to be affected by an auditor, and it's going to be important that you do that for your hospital and any provider, I guess, for that matter. And TGH is obviously someone who wants to do that too, and they have shown results that do tie those into those directly there. And then lastly, I still work in healthcare and on the analytics side, building up performance metrics, but the auditing side is really what stuck out. So for the agenda, let's start now with the healthcare industry consolidation. So what TGH covered, they made sure that they put these slides here regarding how they expanded in the Florida area overall, but then also within Tampa Bay itself. So what does consolidation really do? So if you're in healthcare, you're a big health system. So I'm not talking about the small providers that that are trying to survive out there. There's a reason why they get soaked up into these huge health systems. And it's because it's very difficult to run a practice on your own. There's a lot of coding things, legal requirements. So just the financial overhead is very burdensome, but then also just following all the rules and regulations for what you can do. Now, if you're part of a health system, a lot of these times they can take care of that for you, right? So you have billers, you have people who just do that for their jobs, right? If you're a physician running a practice, it's kind of difficult to find a coder and then have them dedicate to the job, and then ensuring that you have a team around that can really optimize what you have. So that comes into the quality of your care too, because now if you have to think about your staff and that if you're billing correctly, that does take away from what you can focus on. So it's very attractive for these kind of providers to step into a health system, and they do offer like buyouts there. And it does bring some stability to them as well. So it helps. And then on the health system side, what it does is it expands their reach. It increases their coverage for their networks of where patients can come in technically that it's their health system. And as such, it just brings in more opportunities for them to have higher revenue, and they can make cuts and stuff like that, and they can optimize for that practice, maybe that the practice couldn't do on its own. So then, yeah, it's a good way for them to expand. Now, TGH kind of touched on this on themselves when they've been acquiring throughout the island of Tampa Bay. And I think there was a nice diagram here. Oh, keep showing that's her. But yeah, it sounds like they've expanded in the island here. And it's not that you're just building hospitals everywhere, right? You're trying to build out your health system to kind of, it's like a sales funnel. I mean, it's kind of a weird way thinking about it for healthcare, but a sales funnel, right? You have someone that goes into urgent care. Oh no, you don't feel well. And then like, oh, it's actually worse than you thought. Let's send them to the ER. And then, oh, now that you're in the ER at the hospital, now you're more likely, if you need it, right, to be an inpatient if you have to actually stay overnight at the hospital. Now, billing for inpatient care is very expensive. It's one of the things that insurers really want to watch out for. If you can reduce inpatients, you can reduce your costs significantly. And then you can focus on this for any specific healthcare population that is sick. If you can reduce inpatients, you can reduce the amount that you're paying out essentially. So healthcare consolidation creates this funnel here, and it's a weird way of saying it's a sales funnel, but that's actually very important. And Palantir is helping to expand that. And TGH is just one example here because it's specifically a Palantir client, but you can see it depending where you live. You might notice maybe there's a specific large healthcare system in your area or hospital, and then you start seeing more outpatient clinics there. You might see a lab that has their name branded on it, and it just creates this environment for healthcare, this ecosystem. And you can argue if it's good or bad, but I think the big thing to note here is that Palantir enables this kind of expansion here for those who have the resources and the pull to pull this off. So that's one thing I really wanted to cover here. It sets kind of the tone of how healthcare is overall. Now, the meat and potatoes, honestly, here, and I think this is stuff, so HAS, so hospital-acquired sepsis, they don't specifically talk about this, they talk about sepsis, but then also accurate coding. These are huge for hospitals outside of staffing, right? And, you know, staffing is part of everyday life, essentially, and it's gonna go up, there's unionization, and people have to provide the care. Now, if you can automate certain things in your backend and your technology side, and it creates either cost savings or you can capture more revenue, that is a huge deal. So let's go back to that slide actually on the video. All right, so if you can see it here, they do focus on the operational side and as well. So staff ratios is always something that's been talked about. So I'm not going to focus on that today. And what I really think is interesting is that these are scalable and very attractive for other health systems and even possibly for smaller providers. So I'll focus on first the clinical side. So this is always great, right? You want to see better cases of people getting less sick, or they reduce the chances of them getting something that can make their healthcare worse. So they focus on this first, 30% down for the mean length of stay for sepsis patients. And this was a cost reduction of $268,000. So it doesn't sound like a lot, but 30% is still something large proportionally, first of all. And length of stays, so that's the amount of time that you're staying at the hospital. So if you're an inpatient visit, you're, say, instead of 10 days, you're there for 7 days. So that's a 30% reduction. And this is specifically, it sounds like, for sepsis patients. So if you can reduce this amount of time here for patients being in the hospital, that's less resources that a hospital is paying for it. Because sepsis, if it's hospital acquired, is not going to get covered because, as the name implies, it's their fault. So post-surgery, and I guess as a quick side note, it is very interesting. If you've seen doctors create TikToks or just anything on shorts or something, they talk about this avoidance of putting sepsis as a diagnosis code. And if you have any experience with billing, it can cause red flags for someone, right? They're like, is it really sepsis? Let's make sure it's really sepsis, because it'll start the red flags there of like, is it our fault that it happened? And then it creates a whole mess here. And I know it's not ideal, and we should be providing the care as accurate as possible, but that is the realistic part of, the incentives for these hospitals. And just to talk about it here, just a quick Google, you'll see that it is a big reason that hospitals want to look into it and just make sure that it's bad for a person first of all. So then when it's really bad and you have something that goes worse, it costs more services. And not saying that yes, to be realistic, it's going to cost you more to fix that. And it's also financially going to risk that too. So hospitals across the world, not just necessarily the United States, but financially, it is a huge deal trying to reduce sepsis. And if you can lower the length of stay, you can save the money that you're hemorrhaging from it. Or if you're possibly identifying it more accurately as not hospital acquired, say that they actually had to come in because they got sepsis from a disease or something of that sort, and it's not their fault, that's also something to keep track of. But this is something that really stuck out to me because, yes, there's a very strong incentive structure for hospitals to find this beforehand and to make sure that they're not just they're not just going to pay out of the wazoo here and just not care necessarily. So in general, it's always good to reduce the length of stay here, as long as the actual outcomes, they're not patient readmissions. So readmissions essentially is that if you were staying at the hospital, you left, but then you had to come back again, and that's more cost for the hospital because they're not going to necessarily reimburse for the added services because they had to come back for your, not taking care of the issue. And this is also important to the 30% reduction in the average time or mean time on broad spectrum antibiotics. So if you think about this, broad spectrum antibiotics is kind of like a trial and error. So it's broad. You're trying to figure out what is going to work here, what is the specific bacteria that is going to respond to that treatment. And then once you've narrowed it down, of course, through a bettering of symptoms, or maybe a test came back and you found out, then you can have a more effective treatment and not keep it broad here. And that also ties into here, 24 hours of earlier de-escalation of broad spectrum antibiotics. So if you can pull this off for patients across the country, so if you're doing this for thousands of patients and you're doing this on average a day earlier, that adds up to thousands of patients' days. Now think of how many less patients can be sitting there and in a bed that another patient might need, or of course have a right amount of staff there. And it's really a snowball and compounding effect, which is important. So just wanted to point this out. This is very huge. Now, the financial aspect here. So I think everyone understands that hospitals and even individual providers, they want to be able to get paid for what they've done. And in order to do so, you need accurate coding. There's multiple coding that can happen. Hospitals deal with basically a lot of things happening, and they have a whole process in place. And individual offices, they do have to do that as well. And it's harder for them too because, you want to provide care, but you need to make sure that you're capturing everything from the patient so the doctor takes notes. What are the official diagnostic codes or ICD-10 codes? And then also what procedure or what services were done, CPT codes. And understanding that and having the accuracy in it, if it's a manual process, that really leaves you subject to missing out or possibly miscoding, which can lead to basically more difficulties for your life. So let's get back here. So yeah, the 4 million reduction here. So this is opportunity on missed revenue through improved coding. So every hospital would want this, right? And if you can automate this or reduce the amount of errors that can happen from your your coding staff, so there are professional coders. They really have to look through the documentation. It's not as simple as like, oh, this happened, so I have to put this code. There has to be certain documentation as well in order to build that. And it's extensive here. So people do this for their whole careers. It's a lot of money for certain organizations to license out these codes and enable that into their system. The American Medical Association, they're the ones leading on the CPT side here. And every year there are changes to the code. So it's kind of like, well, every year you got to pay for a new data set, even if there aren't necessarily huge changes. But it's still important because you need to have the latest information there. And then also ICD-10 codes. These are for diagnostics. So think of like, what is the disease you have? It's not necessarily what they did service-wise for you. And then hospitals also deal with DRG codes. Essentially, think of it as a bundling of codes and services that they do. And the accuracy in this relies on the capturing of CPT and ICD-10 codes, because you need to make sure that you have a bundled code. It has to have all the items fit the criteria there. So yeah, very important stuff. And Tampa Bay, this is an opportunity that I believe other hospitals are going to see. And if they can scale out this solution over time and just maybe make it like a module per se, right? If you're a healthcare system, what do you care about? So of course there's the staffing aspect here, and maybe that has to deal with a lot more integration, but maybe there's an opportunity here to modularize these out, especially on the coding accuracy aspect. And I'm not sure how ingrained they are and if it's for certain systems, because you still have to think about all the other data at play here, right? If you have an EHR system, do you work with Cerner or do you work with Epic, right? Or maybe you have something else for some reason. And then your financial office might be using a different software here and receiving payment and then ensuring the accuracy of that in the audit side too. And then clinically, right? So this is going to deal with all that information that I just mentioned on the coding front. And, you know, I think it's important that we remember this is honestly the main goal and I think this is the main goal of Palantir, right? If you're creating a less sick population and you're making it easier for clinicians to get staffed, of course, because if you can fix and reduce the length of stay that's unneeded, and then you have it specifically for people who actually need it, then that means you can get better staffing here, because you're going to have the right physicians at the right time, the right nursing staff at the right time as well, and being able to cover who's actually needs to stay in the hospital. But yeah, this was kind of a longer live stream than I thought it would be. And I do want to bring up the chat here just to see what everyone's thinking. Let's see. Okay, looks like it's a little bit quieter today, which I totally understand. I did a late night stream here. Yeah, so I think I'm going to close it out here today. Thank you all for stopping by. I appreciate you listening to me. And I did want to do this format here just because I know that it's a little bit more in the weeds for some of you. And I know that the headlines for investors typically they just care about that, but this is how it can actually scale throughout the healthcare system. And it's important that these hospitals can actually see this kind of value coming here to TGH, because it is honestly something that every hospital is going to want. They want to code more accurately, and if you can automate that, that's even better. And then you want to reduce length of stays for sepsis patients, because if it's hospital acquired especially, then you're not going to be getting paid out for that, and it's going to be added cost to you. But yeah, thank you all for stopping by here, and I'll see you in the next video.